Rheumatoid arthritis. Rheumatoid arthritis definition. Rheumatoid arthritis is an autoimmune and inflammatory disease, which means that your immune system attacks healthy cells in your body by mistake, causing inflammation in the affected parts of the body. Rheumatoid arthritis mainly attacks the joints, usually many joints at once. Early symptoms: joint pain, swelling, stiffness, warmth and redness around the affected joints, morning stiffness, fatigue and malaise, low grade fever, and occasionally flu like symptoms. Late symptoms: ulnar deviation, deformity of the big joints in the knuckles, joint contracture, the restrictive force hurting of muscle around a joint, wrist subluxation, dislocation and misalignment of the wrist bones. Other symptoms: chest pain when taking a breath, dry eyes and mouth, eye burning, itching and discharge, nodules under the skin, numbness, tingling and burning in the hands and feet, sleep difficulties. Causes: the causes of rheumatoid arthritis is not known. It is an autoimmune disease. This means the immune system of the body mistakenly attacks healthy tissue. Rheumatoid arthritis can occur at any age but is more common in middle age. Women get rheumatoid arthritis more often than men. Infection, genes, hormone change may be linked to the disease. Smoking may also be linked to rheumatoid arthritis. Diagnosis: the diagnosis of rheumatoid arthritis is made when you have pain and swelling in 3 or more joints. Arthritis has been present for longer than 6 weeks. You have positive test for rheumatoid factor or anti-CCP antibody. You have elevated ESR or CRP. Exam and tests. 2 lab tests that are positive in most people and often help in diagnosis are rheumatoid factor, anti-CCP antibody. These tests are positive in most patients with rheumatoid arthritis. The anti-CCP antibody test is more specific for rheumatoid arthritis. Other tests that may be done include complete blood count, metabolic panel and uric acid, C-reactive protein, erythrocyte sedimentation rate, anti-nuclear antibody. Treatment. Treatment includes medicine, physical therapy, exercise, education to help you understand the nature of rheumatoid arthritis, your treatment option and need for regular follow-up, surgery if required. Medicines. Anti-inflammatory medicines. These include aspirin and non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen and celecoxib. Disease-modifying anti-rheumatic drugs, DMARDs. These are often medicines that are tried first in people with rheumatoid arthritis. Methotrexate, sulfasalazine, anti-malarial drugs, corticosteroids. Prevention. A balanced nutrition diet is recommended. It may be helpful to eat foods rich in fish oils, omega-3 fatty acid. Smoking cigarettes should be stopped. Excessive alcohol should also be avoided. Minimum bone loss, improve oral health, increase fish intake, maintain a healthy weight, stay active, reduce exposure to environmental pollutants.